You're live.
Hello, everybody. Thank you so much for being with us today. My name is Annamie Paul. I am the leader of the Green Party of Canada. I come to you today from the traditional territories of the Mississauga, Anishinaabe, Haudenosaunee, and Huron-Wendat with a great deal of gratitude. Alors aujourd'hui, nous allons parler en anglais, mais nous avons l'intention de faire une autre table ronde avec des experts en français dans le futur. S'il y a des questions en français, moi, je suis capable de répondre aux questions en français. Je vous adresse des territoires traditionnels des Mississauga, Anishinaabe, Haudenosaunee, Huron-Wendat avec beaucoup de gratitude et beaucoup de remerciements. So we are here today to speak about a humanitarian crisis. And as someone who is a lawyer and a policy analyst, someone who's worked in international affairs, I do not use that word lightly. And in fact, I went and looked for a definition just in case there are those who think that we are using this word in hyperbole. And so humanitarian crisis is described as an event or series of events that represent a critical threat to the health, safety, security, or well-being of a community or other large group of people. And under that definition, I don't think that anyone could suggest that what we are experiencing now in our long-term care facilities across this country is anything less but a humanitarian crisis. And so we are so pleased to be with our panel of experts today, who I will introduce shortly, and our MP, Paul Manley, in order to try to shed some light on the situation that our residents in long-term care and their family and loved ones are facing. And as I said to them before we came on the air, to make it a little bit harder today to look away and to make those who want to speak out a little more courageous about speaking out and demanding the dignity of service for our residents of long-term care that they deserve. In my case, this is something that is a policy issue, but it's also extremely personal. My father was a resident in long-term care in Ontario until May, the end of May of this year, when he died during the pandemic. And he died under the circumstances of neglect that we have heard so much about in recent days. We were not able to see him for a number of months, and he contracted an infection, which normally is treatable with a simple dose of antibiotics, but progressed to sepsis. And by the time it was recognized and he was taken to the hospital, he died within a few hours. And I've learned in the last couple of days that the home that he was in, the long-term care facility, is a facility that now is suffering from another outbreak, and where a number of residents have died. It's one of the facilities with one of the worst outbreaks in Ontario now. And so, whether it's in the name of my father or in the name of the thousands of people who have, many thousands of people who have lost loved ones during this pandemic and are at risk of losing loved ones during this pandemic because of what we are not doing to protect our long-term care residents, this is something that I will never look away from. And so, with that, I will pass it on to Paul Manley. Paul was absolutely and continues to be instrumental in sounding the alarm in our parliament about this and insisting on reform. And so, Paul, I'm going to just pass it to you to say a few words.
Well, thank you so much, Annamie. I'm coming to you today from the traditional unceded territories of the Nanaimo First Nation, speaking people, and there is an outbreak of COVID-19 in Nanaimo today that my heart goes out to them, and my thoughts, they're in my thoughts. So I have been advocating for national standards for long-term care facilities for these homes since I was elected in May 2019. I started to hear about the crisis in Nanaimo Seniors Village, and looked into it. And what happened was Nanaimo Seniors Village is part of Retirement Concepts that owns 23 long-term care facilities in BC and Alberta. and a number of them are on in British Columbia, 7 are on Vancouver Island. These homes have sold multiple times. Every time they sell, they lay off the employees, they rehire them back at part-time wages, part-time jobs without benefits. And these workers who've trained to do this job have to go and work at multiple facilities. So in 2017, the government approved the sale, the federal government approved the sale of Retirement Concepts to Annamie Insurance, which is a Chinese state or Chinese insurance company that was involved in a corruption scandal and was taken over by the Chinese state. So in effect, the retirement homes in my community and on Vancouver Island were owned by a state-owned corporation. And it doesn't matter who these foreign owners are. They have no connection to our seniors. They have no connection to our communities, and they should not be using seniors as a profit center and warehousing seniors in appalling conditions. And that's what the conditions in the Retirement Concepts homes in Nanaimo Seniors Village were terrible, and they couldn't keep employees there. It was so bad that the Vancouver Island Health Authority had to take over the home, the facility. And there was a large number of people complaining about this, and there was a town hall in February before the pandemic. And the Nanaimo Senior, or the BC Seniors Advocate attended at this town hall and gave us a rundown on some of the problems in seniors' homes in British Columbia. The for-profit sector in British Columbia spends twice as much money on building expenses than the non-for-profit sector. They're generating $34 million a year in profit from these homes. They have spend 59% of their revenue on direct care is for the not-for-profit sector, 24% less per resident than the for-profit sector. The for-profit sector is spending 24% less. And the for-profit sector was failing to deliver 207,000 hours of funded care for seniors. So that means individual seniors were getting less care in the for-profit sector than in the not-for-profit sector, which was actually delivering 80,000 more hours per year. And the situation with workers were getting 28% less in wages. So in Nanaimo Seniors Village, they were getting $18 an hour for a job where the market rate was $24 an hour. So this just sets the stage. We've seen this situation happening across Canada where for-profit care homes are having seniors warehoused in appalling conditions. Sometimes these facilities, the shareholders are actual pension funds. And if you can imagine that somebody who's worked, for the federal government and is relying on their pension to pay for the care that they're supposed to be receiving at these homes, and then having that that care be substandard, this is just appalling. This is the snake eating its tail. And so we need to get out of the for-profit business of warehousing seniors and get back to care homes and taking care of people properly. And so we're calling for a national strategy for seniors. We've been calling for that for quite a while. And we want to see national standards for care homes right across this country and for the workers. And that's what I've been talking about in Parliament. I was talking about it in Parliament before the pandemic. And the stage for this humanitarian crisis has been in place. This is the problem, is for-profit care and substandard care for seniors. There have been deaths in government homes and in nonprofit homes as well. But really the serious problem is in these for-profit homes. And now we're seeing that $171 million went to shareholders of these companies, to CEOs and shareholders, using government funding to help with these nonprofit or with these for-profit homes. And so Extendicare, Sienna Senior Living, and Chartwell Retirement Residence show that in the first 3 quarters of 2020, these for-profit companies collectively paid out $171 million to shareholders. At the same time, they received $138 million through provincial pandemic pay for frontline workers and the Canadian Emergency Wage Subsidy Program and other program funding. So this is really an appalling situation. We need to deal with it. And if we do anything, if we get anything done after this pandemic, is to make sure that we take care of our seniors properly and treat these long-term care homes as homes. So thank you for inviting me to take part in this, Annamie. This is a really important discussion, and I look forward to hearing what the other panelists have to say.
Thank you so much, Paul, for that. And hopefully we'll have a bit of a chance for a discussion. But it's important. I mean, all that you've shared is incredibly important and help set the stage for that. I will maybe just mention one last thing. Well, not one last thing, but something else about myself. You know, this is something that a number of our panelists have touched on in their advocacy over the last little while, which is the intersection here between of women, you know, the women who are residents in these homes and the women who take care of them, many who are low income and racialized. And in my case, this is the work of the women in my family. My grandmother spent her entire working life in Canada working as a personal support worker, whether in long-term care homes or in the hospitals. It's back-breaking work. She literally broke her back and had no sick leave, and so had to continue to work if she wanted to be paid. It's very, very poorly paid work. And she was constantly working in environments that were understaffed. And I have relatives that continue to work in long-term care homes under those circumstances. So these are people, these are real people, these are women. And we need to have it understood that the face of this particular crisis is particularly feminized. With that, I want to pass it to Jenny and Michelle Ogilvie and thank them very much for being here with us to share their story. Again, we want people to understand the human cost of this humanitarian crisis. Jenny, your mom is in long-term care out in Nova Scotia, and Michelle's your cousin and was the one to is the one to send you reports, updated reports. So perhaps you can share your story with those who've joined us today.
Thank you so much for inviting me on here. I'll try to put this in a small length of time here. So December 30th, when I woke up, I wasn't aware that this would be where I would be in 5 days. But, you know, in posting that Facebook emotional post, it has led to so many, I guess, amazing things with people reaching out and telling me their stories. But just to give you just a quick overview, my mother is in Grandview Manor in Berwick, Nova Scotia. What sparked this entire thing was we have a distant relative that actually is associated directly with this long-term care facility. And she kept reaching out to the staff there saying, why are you not contacting the family? So finally, they kept saying, there's nothing on file. There's nothing on file for her. On December 30th, this person that is directly related to the facility, her father was informed and then told one of my mother's brothers. And within an hour, we were all in there. This was 11 days after she broke her hip, 11 days. So on December 19th at 5:40 a.m., they found that she had fallen and was taken to the Kentful Hospital. Within 1 day, she was returned to her bed at Grandview Manor. I was on the phone call on December 31st with the registered social worker that's there. She's telling me that there was nothing on file yet. She had had conversations within the family over the past 3 years, but again, nothing on file. There's just complete inconsistencies with communication. She's had a number of falls which we were not made aware of. But again, prior to my mother going in there, she was fully capable of walking, and we were told that she keeps tripping on her oxygen cord or tubing. I don't know if that's true or not, but Michelle, who is on the ground there, and me only via video, can fill you in with what else she saw. But basically, she said that because I'm not next of kin, I'm not able to release any information. When I contacted her in 2018. So basically, we went in there, what we found, again, Michelle will follow up with that. But in such time that we have been on the phone and we've been asking questions upon questions, why wasn't a spinal block offered to her with her being not eligible for, hip surgery because of her COPD? Why was none of that offered? I asked if I could see the medical records from her fall. The nursing home, or sort of the long-term care facility, said that they didn't have anything on file. There's also significant bruising to her face. We have a picture from May 2020, where her nose is fine. Her nose is completely crooked now and bruising up here. So something has also happened to her, which was not brought up to me during my conversation with administration that day. So I still have to follow up with that. With regards to her morphine, she's completely out of it. I was told by the registered social worker that is on site, that has been dealing with my mother. I asked her, I said, so basically what you're saying is that if my mother would have died of this, we wouldn't have been notified. And she said, yes, correct. My family lives 1 minute away, 15 minutes away. She's also proceeded to tell me that no one's been there in 3 years, which is absolutely nonsense. No one steps up, nonsense. So there's just been nothing but hearsay, and this is what's going on. Regardless, care is care. Care is absolutely care. My mother's being administered morphine. We've asked to see how much, because she's with her grandmother that died 60 years ago, her other grandmother that died 20 years ago, completely out of it, as needed. They give it to her in applesauce. Again, we've asked, how much is she being given? She can barely communicate. So if this is the only problem, why is this happening? They're not, we've also inquired about every time that they administer morphine, are they taking their vitals? The only thing they've been doing is checking her temperature and her O2 levels on the machine. No blood pressure has been taken. I want to share with you something that happened this morning, and I'm going to bring up my phone just to read this directly. I have, since this has all happened, we have Michelle and another of my mother's cousins in there daily, because, just to see what's going on, because we weren't aware of anything that was going on. So this is what happened at 11:49 Nova Scotia time. I got a call, I got a text from, again, the cousin that was in there. A lady just came into your mom's room to take her temperature. I asked if blood pressures were even taken. She says periodically, but not every day. Then she said, as she was walking out, this is not a hospital. So I wanted to share that with you. How much more do you want me to go into? Oh, okay.
No, that's, yes. I mean, we're going to hopefully have a chance for a bit of a discussion. And I wanted to jump in a million times myself to trade stories. I know that some groups, some loved ones have been creating Facebook groups and different groups to share these stories. And I mean, I have to say that a lot of it feels very familiar, and therefore makes me feel very, very uncomfortable. But I don't know, Michelle, if you wanted to share something, or if we could circle back around, but I don't want to cut you off. Michelle, did you want to share anything about the conditions or any observations?
My observations upon entering the room is more or less shock. There was, I first noticed her oxygen was improperly connected. It was plugged into a power bar loosely, and there was a plug directly into the wall where it could have been. There was an entanglement of electrical cords, which poses a danger to staff and resident. Personal care, hair, nails, skin. She had a full diaper. I had found expired medication in her belongings dating back to 2017, which I do not believe that is proper. It just shouldn't be. Her help button that she would use to press to have a nurse or caregiver come check on her was not in the vicinity of her use, or she could not reach that. It was not reachable for her. Liquid was not in any way accessible. She could not reach that. Her as a person, communication, there was no TV hooked up, no radio going. Her form of communication prior to breaking her hip has always been her cellular phone, and her family has kept contact with her through the cell. And many times we've tried to contact her, and there's been no answer. Contact has been made to the home with no response. It is a miracle that we found out while she is alive. It's scary to think what could have happened. And this is just one story, one of many. And there's horrific stories. There's been people contacting me, and it's not just one home, it's multiple homes.
Yeah.
Our seniors deserve the best. They're what this country is built on.
Yeah.
You know, the
Yeah.
respect, the dignity. There is a lack, and there is a problem that needs to be addressed. And for many years there has been a problem, and I think it's time to stop talking about the problem and step into a solution.
That's right.
You know, if nothing changes, nothing changes.
Yeah. Michelle, thank you so much. Jenny, I see it's been really difficult for you just hearing this, and we're here with you. And Michelle, what you've just said is a really perfect transition, because we want to talk about the solutions, and the people who we've invited here today have been proposing solutions throughout the pandemic and prior to it. And so I just want to introduce them so that they can join our discussion. Today with us, we have Dr. Gutman, Dr. Stamatopoulos, Dr. Grinspan, Moira Welsh, and Laura Tamblin Watts, and also Dr. Sinha. And I'm going to just give each person, and I'm sorry, we're trying to squeeze a lot in here in a short period of time, but I'm just going to give each person a minute to give us let's say their top note observations about what we can do, what we should be doing urgently now as people continue to die, and what some of the long-term solutions are. And then hopefully we'll have some time for a bit of a discussion. And I want to start first with Dr. Gutman. Dr. Gutman is the president of the North American chapter of the International Society for Gerontechnology, the vice president, the International Longevity Center Canada, and also a professor and director emerita in the Department of Gerontology and Gerontology Research at Simon Fraser University. And of course, many more things, but I will just start with that. And Dr. Gutman, you have some thoughts to share with us.
Thank you. I hope that we will use the opportunity of the pandemic to deal with some of these issues that have been around for a long time. Those of us who are long-term advocates who worked in this area for the last 10, 20, 30 years know that these are not new. What needs to happen is that we need to look at those facilities that have not had an outbreak and see what are they doing? What are they doing that they're doing right, as opposed to keep talking about the bad things. Let's get the good things. What can we do? Certainly family are very important as advocates for our seniors, whether the seniors are in long-term care or in an acute hospital. Family are the eyes and ears, and that need to speak up. I'm often concerned that even in a litigious society like the USA, why are not more of the families speaking up and putting the operators of care facilities feet to the fire to ask why they're not doing better. You know, we know that it's relatively recent that in the case of staff, they started doing background checks to see if people had criminal records. What are they doing in terms of screening staff for health concerns? Or for that matter, when family goes to visit and they bring Johnny who has a runny nose. So, you know, we need to think beyond this immediate crisis to what's going to happen to make things better in the long run. We also need to remember that we're dealing with two things here: the issues of systemic problems, but also on top of that, pandemic and disaster. So I got first, you know, involved in this area at the time of Hurricane Katrina. And since then have been asking, you know, the Public Health Agency of Canada and various of the organizations of operators of care facilities, what have you got in place for disaster preparation? And I think you will find that those facilities that haven't had an outbreak were those who took that seriously and did planning. So it's one thing to talk about standards and planning. The other piece that all parties need to recognize is that if you don't put some teeth into some regulations, you know, it's one thing to have something on your books, a policy statement or a procedure, but if you don't act on it and somebody doesn't act as policeman, we're not going to get any better.
That's right. Thank you very much for that. In colloquial terms, doctor, we say there, you know, there's talking the talk and walking the walk, you know, and talking's not walking, and it's time for some walking. I wanted to bring in Dr. Vivian Stamatopoulos. Dr. Vivian has a Doctor of Philosophy from York University, and she's also been one of the most outspoken advocates in terms of long-term care issues throughout this pandemic, particularly during the second wave. And so, Doctor, you know, please, again, share what thoughts come to mind. And we're going to try to keep this part as shorter so that we can have a bit of an interaction, because this is an extraordinary panel that we've managed to collect today. And we really want to hear from all of you and hear you speaking with each other. Dr. Vivian?
Sure. I mean, I've been very clear from the outset. I don't think profits have any place in long-term care. And I think one of the quickest things we need to do is divest from for-profit long-term care. I mean, I was in a town hall a couple months ago with Jagmeet Singh about wanting to make Rivera public, because Rivera is owned by the federal government, as someone had mentioned earlier, and is the second largest for-profit chain facility in Canada. And that it would be a very good start to that, you know, goal of nonprofit, solely nonprofit delivery, because I mean, the evidence is undeniable. This both pre-pandemic and post-pandemic, during our pandemic, we have seen the for-profit sector fail abysmally, right? Even before the pandemic, we have a litany of research that shows there was more transfers to hospitals, more deaths, more bed ulcers, more likely to be understaffed these facilities. There's lower quality of care provided, lower wages provided to the staff, and heavier workloads, which has resulted in a revolving door in these facilities, particularly among the gendered and racialized workforces that are indeed being exploited, quite frankly, by these owners. And we have seen a shift over the past 20 years from a majority nursing population within these homes to a majority, and nurses, of course, are a higher regulated, higher income earning profession, to this unregulated workforce that is being exploited for profit garnering purposes, quite frankly. So I don't think there's any question that, you know, in the long term, obviously, no future beds should be provided to for-profit providers. I don't think that if this was a children's daycare or in another sector to make it very obvious that if there were thousands of deaths by a childcare provider, would you keep allowing that provider to open up childcare centers? I mean, it would never happen. So why are we letting it happen in with our seniors in long-term care?
Dr. Vivian, can I maybe just ask you one thing about that? Because I think you touched on something that's very important.
Yeah.
What would your response be to those who say, well, these are individuals who are at the end of life, and it's to be expected? Is there? I'll just
Is
leave it there and let you
negligence to be
answer.
expected? Is negligence, is that, and that's exactly what, you know, the underlying premise of those kinds of ageist statements reveal. No, it is not okay. It is not expected that just because they're going to die doesn't mean they're going to die a terrible, solitary, confined death, as we have seen for far too many in the first wave of the pandemic, and even now into the second wave. So I have no time for those kind of ageist rebuttal comments, which quite frankly have no place in any Ontarian discourse, Canadian discourse. So yes, I have no place for that kind of rhetoric. No time for it.
Thank you. Very, very much for that. And it's important to say, because these are the things that people say. I think there's also a misunderstanding about the rates of death. This is something beyond that. And certainly, as you said, there's a significant link between the rate of death in for-profit when compared to public long-term care facilities as well. I'm going to now call upon Dr. Grinspan. Dr. Grinspan is the CEO of the Registered Nurses Association of Ontario. My grandma was a nurse before she came to Canada. She couldn't and there are many women in that situation. They come here, they can't get their credentials recognized, and they end up working. They want to be in the healthcare profession, and so they end up working as personal support workers in our long-term care facilities. Dr. Grinspan?
Thank you so much, Annamie. I'm so sorry that you lost your father, first of all, and also to Jenny and Michelle. Let me start by saying I'm absolutely exhausted. Exhausted because I spent this entire time where many of the politicians were traveling and having fun, and not you, but I need to say that, trying to support nursing homes to get the stuff that they need. So that's number one, day and night. Exhausted from trying for the last 2 decades to get for seniors in nursing homes, as Gloria said, what they need and deserve. This is not new, but it has reached a cenizide, and I put an article for people to read that. It is a cenizide, and you're right, Annamie, that is also racism and discrimination, because the workers are racialized, most of them. What is tragic is that not only all that Vivian said is true, but actually we reward that. Yesterday night in a Zoom with my family, I was considering giving back this Order of Ontario, which I got in 2003, because the person that perhaps has contributed the most to the demise of nursing homes in Ontario, then Premier Mike Harris, is being invested in the Order of Ontario as we speak, you know, this year. A person that not only went through Walkerton and SARS and Hyperwash and you name it, also actually is the one that grandfathered or grandparent, whichever you want to call it, the for-profit nursing homes to continue with 4 people per room, which is a direct contributor to what we are seeing now. Not only that, the homes that Paul mentioned at the beginning that are getting the huge amount of dividends are being rewarded too. They got extra beds in this province, right? So not only they didn't close as it would have happened in Australia and other countries, they actually got rewarded for that. So, you know, I'm too long at this to think, Gloria, that focusing only on the ones that did good will deliver any results. People are doing heroic work. Michelle and Jenny, and to you, Annamie, I don't know about the homes where your family members were, but I can tell you for sure that many of the homes, the PSWs, the RNs, the RPNs, and the few nurse practitioners that there are trying heroically to do good work. It's impossible. I wouldn't be able to do that. I put in my blog, and I invite you to read, it's called Doris COVID blog, an anonymous piece sent by a nurse, sent to one of those homes during the first wave. And she put it, of course, unanimously, because doctors to defer, nurses to defer from physicians are not independent agents. They have an employer. And the employer muscles them not to speak. That's why you don't hear them freely speaking about what they see. So she basically went to a home where it was an agency nurse that had been 16 hours there, right? And had not left simply because was waiting for someone to come and not leave the seniors abandoned completely. But you tell me how that nurse could provide to all the residents the care or the water or I'm not even talking humane care, I'm talking basic care. Hence why RNO has been asking since 2016 for what we call the basic care guarantee. And now that we have a site, and we better start to speak that way about it, if we don't achieve that, Annamie and Paul, we will never do it. Never, never, never. Because you give it another 6 months, which will take to really have most people vaccinated. Give it another 6 months, and then it will come, rightfully so, people with cancer saying, I have been delayed diagnosis or treatment. Will come people with other conditions, and we, the same panel, will be here saying, who do we deal with first? Or do we increase taxes? But very few want to increase taxes, right? So it's a systemic disgrace to this country, and Ontario today is at the head of it. We are the most per capita residents that have died in nursing homes. It's a systemic disgrace of major proportions, and it's a disgrace that not only we don't punish, but we actually reward. We reward with Order of Ontario. Premier Harris makes $250,000 in addition to the dividends just to sit part-time on that board of Chartwell and give the phone calls to likely Premier Ford and say, and I dare to say, let me see the papers that were put for Premier Harris to receive this Order of Ontario. I want to see them. I doubt that they exist even. It's a disgrace that honestly, I have worked in 3 wars. It's worse than a war. It's worse than a war. A war, you send the soldiers, at least in most countries, prepared to fight. Not that I support any war. Trust me, I became a peace activist by working in wars in Israel. But at least you send soldiers prepared. Here, you send the workers, those workers that now we are saying is their fault, their fault, their fault. We send them completely empty-handed. We send few in between. It's impossible for them to do any decent work in good times, let alone now. And I'm not saying we don't need to do inspections, and I'm not saying we don't need to expect good work from workers. Absolutely, I do. But focusing on that is a distraction to the national standards and a basic care guarantee that we absolutely need. So there is a petition for a long time on the basic care guarantee. I urge you to sign. I urge also all of us that are on the same page to push for that. The Prime Minister said that he's committed. We sent a letter many, many months ago asking for national standards. He said, and he has been public, that he's committed to it. The premiers, of course, each one of them wants money without strings attached. And we say to the Prime Minister, put the money, and the premiers that want to join in delivering national standards, take money, and the others don't. And let things sort themselves. to try. We totally agree at RNO with the research on for-profit and not for-profit. No one is going to close the 70% of the nursing homes that are for-profit. Nobody, not any party even. So new homes absolutely do not for-profit, but we have a problem with the current ones. So national standards is the way to go. Thank you.
One thing that we'll make sure that we do, thank you so much, Dr. Grinsman. We're going to post the links to the different resources that people have been putting in the chat so that we can keep the conversation going. I want to really emphasize this is not a one-time thing for me. I see you and the people on this panel as a brain trust, and for us, I believe this is an election year. I believe this is exactly the time when people in Canada should hold every party to account and make sure that we all have a plan that is informed by your expertise about what needs to be done. So I know there's a lot to say, but this is not a one-time conversation. I promise you, I will be chasing you for these recommendations. Oh, sorry, you're on mute. I'm just going to pass. I know this. We have so much to say and not very much time, but I'm going to go on now to Moira Welsh. We're going to go until 2:30. We had intended 2:15, but we'll just go until 2:30. And then hopefully I would love to leave at least 5 minutes at the end for just an exchange between the panelists. Moira Welsh is the author of Happily Ever Older, Revolutionary Approaches to Long-Term Care. She's an investigative reporter with the Toronto Star and has been one of the people writing most extensively about senior issues with a particular focus on long-term care as it relates to social justice and the environment. Moira, I'm passing it to you, please.
Thank you so much. I do want to say I understand Doris's sentiment and weariness with the massive efforts over many years from many, many people to create change. But I really do think that we are in a time of reckoning now. And I think if we don't fix long-term care now, we never will. So I'd like to say, frankly, nobody wants to go into a nursing home. Nobody expects to live in one. Some of us inexplicably will become very vulnerable and fragile, and we will end up in one. I think it's vastly more important that we have many, many more options in the community, like home care and other living arrangements that are becoming a little bit more popular now. But the reality is some of us will end up in homes, and it could be some of us here speaking today. So I think the point is that we need to use this opportunity to create calls for change. And I was really heartened by the reaction to the Star's front page on December 31st. Our new owners wrote a long editorial on the front page, and they spoke about their commitment and the Star's commitment to pushing for change in 2021. Will that be enough? It's hard to say, but I think it's really important that we use all of our voices together to really demand something better. And I do feel like the public has really started to understand what isolation means for people with long-term care, the incredible loneliness that they have felt. I think people are feeling lonely themselves in their own homes. And I think that there's a real sort of deeper connection to the realization of what we're doing to people in long-term care. We need national standards. We need standards or a strategy for staffing and at least minimum 4 hours of direct worked care per day. And we need to create a system that actually allows frontline staff to feel a greater sense in their role in the day. So we need to value those people with better pay, better pensions and benefits. But what I've written extensively about is the relationship-based care. And so even if we get all that we want in terms of more hours of care and a better workplace in a sense, if we don't create a system where the relationships between the workers and the residents matter, and the residents actually have an opportunity to live with meaning and purpose and vitality, then we will still have failed. So I'm really hopeful that we can explore all these issues. I will be doing it through my work, and happy to talk to anyone else who wants to discuss this further. Thank you.
Thank you so much, Maura, for that. Absolutely. And as I said, in the case of my grandmother, she was the chief nurse on the island that she came from in the Caribbean. It was about caring for people. This wasn't a paycheck, and so that connection is the thing that was the hardest to maintain under those difficult working situations, and absolutely is the key to care. Thank you so much for making that point. And there was a point made in the chat, which of course the people on this panel are very aware of, which is that the residents of long-term care are not simply seniors. There are many other kinds of people living in long-term care as well. And these issues that we're talking about impact them as well. And the pandemic has been very difficult for those residents as well. So when we talk about long-term care, we're talking about all of the residents of long-term care, and that's important to remember. Moving on to Laura Tamblin-Watts, who's the president and CEO of CanAge. Just briefly, everyone here is incredibly well respected within their fields. Just to highlight with Laura, that she's a fellow of the Institute of Life Course and Aging. And she's someone that is very much sought after for her expertise on older adults in Canada and around the world. Laura, what are the messages that you're hoping to share with people today?
I just wanted to focus on a few things, but first of all, thank you for your leadership and thank you for bringing together this panel. And I think the fact that people are willing to come so quickly speaks to the urgency. Every day that we are not moving forward on this issue, we are losing lives, family members, friends, leaders in our community. So the urgency is real. I wanted to focus my comments not so much on the long-standing issues of long-term care, which are legion and extremely well known, but on sort of a hopeful point. We can actually fix this problem. It is in fact just a matter of political movement, not lack of knowledge, not lack of data, not even a lack of consensus, only a lack of action. And so when we're thinking about how Canada has fared very specifically within the coronavirus time, it's actually fairly horrific. And I don't use that term with hyperbole. If you look at comparator countries, we've done extremely poorly. And if you look at the loss of life in long-term care, when voices like those on this panel and others have been calling into the wind saying we need to prioritize long-term care, not put all the personal protective equipment in acute care and turn a blind eye to those that are staff members and residents. We need to prioritize testing so that everyone who lives, works, and visits long-term care gets tested before you get in. No testing is perfect, but the Swiss cheese approach by getting a swab before you go in and out is a very effective. And we only have a few small pilots. It's unconscionable. We need to get vaccines for COVID-19 into the arms of our most vulnerable. And Canada has been far behind where we need to. And viruses don't take holidays. And certainly that was a challenge in Ontario, where holidays were taken by the very people who are supposed to be vaccinating our most vulnerable. We also are not using our distribution systems for the COVID-19 vaccine. We have public health who does this very effectively, nurses, pharmacists, community health centers, and yet those are not being used. The lack of communication and uptake on the COVID vaccine has been really extremely poor. And one of the other pieces I just wanted to close on is that when we think about infection prevention and control, not only do we need to prioritize right now IPAC specialists in long-term care homes, not on acute care close by, not in theory in the community, but in homes to keep staff, residents, and essential caregivers safe. But we need to immediately vaccinate for flu, pneumonia, shingles, and pertussis. These are things that we've long been able to fix, but have simply not spent the dollars to do it. So those are some actions that we can take right now that will save lives. And I'm so grateful that CanAge has been able to be part of this conversation, and we look forward to working with you.
Thank you very, very much for that. And it is, again, very important to underline what you said, which is that we have been amongst the worst performers. Actually, for most of this pandemic, Canada has had the highest proportion of deaths in long-term care when compared with other developed countries. The worst performer, the worst. So might people have died? Absolutely. Did we need to have so many senseless, pointless, as you said, unconscionable deaths? Absolutely not. And we have been the worst. And that is a shame. That is a scandal. Our final panelist is Dr. Sinha. I had a wonderful opportunity to meet with Dr. Sinha in his role with the National Institute on Aging. He's also the director of geriatrics at Sinai Health and just a passionate advocate, and has written extensively, particularly during this pandemic, on long-term care. Dr. Sinha, thank you so much for joining us, and we'll close off with you and then open it up for the last few minutes.
Yeah, thank you very much, Annamie, and again to all my colleagues. I think you have an absolute brain trust here of some of those passionate, dedicated people who've been working on these issues for so long. And just as Laura and others were just saying, that throughout this pandemic, we've all been active, really trying to get more people engaged on these issues. And I agree with my colleagues saying, if we don't get it done now, after everything we've been through, we may never fix these issues that really are fixable. I mean, we actually have all the evidence in front of us. We know what leads to good care and what doesn't lead to good care. And just to add on to what my colleagues have been saying, really, is that fundamentally, when you actually think about our care and the way we provided it, we never actually saw long-term care as a part of our universal healthcare system. So back in 1966, when we created Medicare in Canada, we included physician services and hospital services as publicly funded services that with standards. But when you thought about long-term care or home and community care, pharma care, these aren't things that are actually guaranteed. These are up to the provinces and territories to deliver. And fundamentally, when you look at Canada as a whole as a result, even though these are things at a provincial and territorial jurisdiction, some of the reports that I shared with you that we published last year when we did a full review of long-term care in Canada, where we stand compared to our global partners, we find that Canada has a terrible track record. And the fact that right now we spend 30% less as a country on providing long-term care than the average OECD country. This is the rich countries, club of the world. We just published a piece in the Wall Street Journal this past weekend where they looked at how out of 24 countries around the world, as Annamie was referring to, out of 24 countries around the world, where 1/3 of their deaths have occurred in long-term care countries. These are high-income jurisdictions from around the world. Canada is actually the second worst offender behind Australia now. Australia, 75% of their deaths in long-term care. Canada, 72% of our deaths in long-term care settings. And the global average has been about 36 in these high-income countries. And I'll just compare in case you say, well, Australia is a lot worse. Well, that's out of 908 deaths, and we've had thousands and thousands of deaths that have occurred in Canada. So I think fundamentally, when we start thinking about whether, what's the ownership model? How does this work? We have to fundamentally realize that in Ontario right now, the government, our publicly funded long-term care system funds homes to provide 2.71 hours of care. So even if you're a not-for-profit or municipal home, which have a much better track record of providing care, they even admit that we can't even provide good quality care with 2.7 hours of funded care. So what do municipal homes in the City of Toronto do? They use their municipal tax bases. Not-for-profit homes are having bake sales and other things because they're trying to reach that 4-hour-a-day standard, which our government in Ontario is only committed to recently, but will only enshrine that it actually happens by 2024-25. So the fundamental thing is right now, I think as Laura just said, it's political will in action. We actually know what we need to do. What we need to do is we need to actually tell our elected officials, let's get this done now. Let's not wait till 2024-25. Let's actually get this in now. And for people who say, well, it takes time, it takes time to recruit, Doris will tell you this, and we all tell you this. What did they do in Quebec in May? In May, they said we've lost 10,000 workers. We understand the barriers to getting people into these roles. And so what did they do is they went out and recruited 10,000 folks. And what did they do? They paid for their training. They actually paid them, so they didn't actually have to work part-time while they were doing their training. And they actually had those workers in place by September. They had those workers in place by September. And currently in Ontario today, we have 224 homes in outbreak. We only have about 60 homes in Quebec in outbreak today. What did BC do at the very beginning of the pandemic? They stabilized their workforce. They saw their workforce. They recognized it was primarily women, racialized, immigrant, and they said, we're going to give you all full-time salaries with sick days and benefits, the whole deal. And we're going to put you on full-time positions. And by stabilizing their workforce, by doing that, BC's had a far lower rate of outbreaks compared to other provinces across the country. We have the solutions and we could do them. The thing that's stopping us right now is political will. And finally, with our vaccine rollout, this is our way to get out of this. But right now, what pains me is of last night, we have over 148,000 vaccines that have been delivered to Ontario. We have hundreds of thousands that are on their way here. And of course, this is the story across Canada. We've only administered, as of last night, 41,000 vaccinations at the moment. And we have 72,000 residents in our long-term care homes, 100,000 staff, who frankly, we've had 21 days to start getting these vaccinations rolling at a quick pace, because as soon as we vaccinate people, we're saving lives. And vaccines do nothing to help anybody when they're sitting in the freezer. So we actually have an opportunity to even get ourselves out of this pandemic sooner and end this nightmare. But for some reason, we just have a lack of political will and political action. And I think right now we need everybody to kind of recognize this and get this done, because we know what needs to be done and we just need to do it. So I'll stop there. Thank you for your time.
Thank you so much. And thank you so much to all of you for your comments. I really want to do a lightning round, because this is, it's so important when you have, again, this kind of expertise in one place, and you've all touched upon different things. We want to sound the alarm bell, and we are going to continue to do that. But we always talk about converting the opposition into proposition, particularly because that's the thing. What do we do? What do we do now? What do we do tomorrow? And so as much as I dislike this tool, I want to just do a lightning round with all of our panelists and just have you say just one or two words. I mean, and first for the short term, the urgent part, the people that are dying today and tomorrow. What is the one thing that you would say to our, our officials that they should do today in order to make it less likely tomorrow? Dr. I was going to say Samir. We're not on a first name basis yet. But I was going to say, Dr. Sinha, in your case, it sounds like vaccination is your thing, or is there something else you would say today is the thing?
I'd say vaccinate, don't hesitate. And number two, it's staff these homes properly, and properly means properly paid staff and the right hours of care. Done.
Okay, so vaccinate, proper hours of care, vaccinate and staff. Laura Watts?
Yeah, Samir and I agree mostly. The thing that we need to do most is get vaccines into the arms of our most vulnerable, and the caregivers are our most vulnerable, and tether that with as much testing as possible.
Okay, so you added testing to that. Moira Welsh?
I would have to
your names because I want everyone to follow your work after this conversation. So it seems odd, that's why I'm doing it for everyone. Moira?
Thank you so much. I would have to agree about the vaccinations for residents and workers. I also think that we really need to look seriously when we do have residents who are in shared rooms where one person has the COVID and the other person does not have COVID. We need to find ways to separate them safely and allow people to actually live. They do not have to die in these homes.
Okay. So we have separation, vaccination, staffing, and testing. Dr. Grinspan?
No doubt vaccination, and the excuses need to stop, because have been nothing but excuses. And national standards of 4 hours of care of regulated and unregulated, because the for-profit, including consultants of for-profit, would love if it's only unregulated and quiet. And also keep the families in. The families are eye and ear, and they need to be in, not out ever again.
That is for sure. And I will say on that point, it absolutely tortures my family to this day, what they could have prevented had they been there to be the eyes and ears. Yes, okay. Dr. Vivian Stamatopoulos.
You got it. Well, I mean, I would obviously say family access, since that's how I started my advocacy, because I knew how dangerous it was locking out family. And to that end, we actually tabled Bill 203 with Lisa Gretzky, and we're still waiting on the government to pass that. I also think they need to pass the Time to Care Act, which would immediately address the 4-hour basic care minimum, which has to happen. And stricter penalties. I think we really need to look at national standards and take Prime Minister Trudeau up on his word about amending the criminal code to have more stringent accountability of these homes, because right now there's just no rationale, no real incentive for these homes to do better.
Thank you very much. And well, yes, doctor as well, Dr. Gutman.
Well, I would agree on what all the others have said. Also, get PPEs in there so that the families can get back in and we deal with the psychosocial issues as well as the physical issues.
Thank you very much. And Jenny, I want to ask you what you would do. And you had something, a last thought you wanted to share.
I just wanted to share one other thing, as you brought me on here to share the human experience element to this. And I just want to bring up one more thing. In the events that have been leading up to today, we just quickly, my mother was in a different room with another person who now has died in August. Going through her things, we actually found this deceased person's purse with all of her identification and everything in it. I actually reached out, I found her obituary, I reached out to her family, and then talked to the next of kin. This person that was sharing a room with my mother, again, since has moved, their next of kin was never notified that they were taken out of the home for medical reasons and died in the Halifax hospital. So this manor never contacted the family during that transition, and also when she passed, the hospital contacted. So this next of kin called and said, I want my sister's purse. The response was, they can't find it. 5 months later, I'm now finding it in the bottom drawer of my mother's stuff with all of her identification, and we've told her that we will get that purse back to her. But that on another level has no accountability. There's also clothes in my mother's room that are named under someone else's. There are family pictures that are not of my mother's hanging in her room, and some guy's TV that is in her room. So it's like, let's switch them and let's not take care of the family. This family had somebody die. They can't find the purse, social insurance number, driver's license. That leads to a whole new level of what happens, identity theft. There's just, the purse is missing. And beside it is also my mother's purse, which has absolutely nothing in it.
Yeah.
So I've yet to get to the bottom of it.
Boy, you're in Nova Scotia and I'm in Toronto, and we have same stories about we can exchange the same stories about that experience, and that is very painful to know. I really want to thank every single one of you for being with us. And I know you had very little time to share thoughts about something that is very, very close to you. I particularly want to thank Jenny and Michelle. I know from personal experience how difficult it is to share, but in both our cases, it's something that you do to honor as well the person that is living through this experience or has lived through it. I really hope that this continuous sounding of the alarm bell that you are all doing, while at the same time proposing concrete solutions, that it will break through. I know that the solution is for people in Canada to raise up their voices. This is how we got the Canada Health Act. That was very much a people-powered piece of legislation, and it's clearly what is needed again. I would love to have us, we will collect all of the thoughts that you shared and share them. This is not a partisan issue. I would love to see you all contribute to what would be a shared platform across the parties to improve long-term care in the days, weeks, months, and years to come. We're going to say thank you now. We're going to have media availability right after our live ends. I would just say to every single person that is listening, these are the people who are on the front lines in our country working on this, studying it, writing about it. Please hear their call. Please put the pressure on your elected officials to make sure that they are doing all that they can every single day to demonstrate what a life is worth, because this is really what this is about. You know, what is a life worth, and what are we willing to do to respect human life in this country? And so we're going to say thank you so much. Thank you so much for your time. Merci à tout le monde. Nous allons essayer de faire une autre table ronde en français avec des autres experts en français. Thank you for joining us, and we're going to say goodbye on Facebook Live now. I think we're off.
We are.
Are we off?
Okay, thank you, everyone. It's Noah again. We're going to open up for just a few minutes of an availability. If there are any journalists on the phone, I believe Mia from CP is on, and we can start with Mia for questions to the panel. Go ahead, Mia.
Sorry, I'm just trying to unmute. Dr. Sinha, my first question is for you, because I think you might be the one tracking this data. Do we know how many long-term care homes have actually had vaccines start in them yet? You're muted.
Sorry, no, that information hasn't been released, for example, that I know of on a national basis or even at, say, an Ontario level basis. I think the only data that the Ontario government, for example, is providing right now is just the number of vaccinations. But right now those vaccinations are being coordinated by hospitals and towards, but we don't actually have breakdowns as to how many essential caregivers, in essential family caregivers, how many long-term care frontline workers, and how many actual residents have actually received vaccines out of that 41,000 number that I quoted you from last night.
Sorry, I think you're muted, Dr. Grinspan.
Oh, sorry.
Oh, you're still muted.
Unmuted, and here you go. Follow Jennifer, Dr. Jennifer Kwan. She actually posts every single day the rate of vaccinations in Ontario, in all the sectors and everywhere. So I suggest that you follow that. She was the same person that also actually a lot of data that you can follow overall in Ontario, very accurate and excellent.
Wonderful, thank you. And a follow-up, and I mean, anybody feel free to jump in here, but you know, on the vaccines, and all of you seem to think that that was one of the critical things to do, and long-term care residents and workers were supposed to be prioritized. Have we seen that that's actually been happening, or do we just, because we don't have the numbers, really, we don't have the evidence? It just, from anecdotally, it just seems to me that the residents in particular are not being vaccinated yet.
So I want to comment on that. It's another tragedy, because the reality is that all the excuses that have been used for not doing them first are just that, excuses. And the data is very clear from Pfizer that you actually could have done it, and it was a policy decision. The biggest mistake in Ontario is to have given the entire file of anything on this pandemic to hospitals. If primary care would have been involved, home care would have been involved, and public health would have been involved, nursing homes would have gotten the vaccine first, IPAC would have been better dealt with. But all the eggs in the baskets, including now purchasing new homes, was to hospitals, and the results are clear. They are overburdened, and even Anthony Dale, the head of OHA, is saying, stop giving us everything, we can handle it. So that's the only problem here.
And just to build on,
sorry, go ahead, Samir.
No, just to build on Doris's point, I think the one thing was clear that when we were actually doing the influenza vaccination process to try and avoid a twindemic, we made sure that all the homes actually ordered their supplies on time. When the first batches of influenza vaccinations were made available, all the homes were able to vaccinate their residents and staff efficiently, you know, within a week or two. And just this other week, West Virginia actually had their National Guard participate in partnership with their 214 long-term care homes, and all residents and staff were vaccinated within a 2-week period. They set a target of December 28th. They missed it by 2 days, got it done by December 30th, And in Ontario right now, we have 72,000 residents and 100,000 staff, and probably another 72,000 essential family caregivers. I'm just going to give that number out. And right now, all we have is about 43,000 people who've received vaccinations. And I would think a sizable chunk of that don't even include people who work in long-term care.
Yeah, and I just want to build on Samir's point. Is exactly so. I mean, this has been a failure of logistics, and I think it's because we've been thinking about it as a logistical problem or a military problem. This is actually a vaccination problem, and we have excellent vaccination vehicles and structures already in play. And so we're seeing across the country, of course, it's different in different places, but we've been seeing across the country an odd choice to not use existing vaccination vehicles and structures, which are very effective and very efficient. And there really has been no excuse for it.
I can keep going with questions if there's no one
Yeah,
else.
are there
online.
any
So-
further, I mean, I know that I
I
believe,
want to comment then on that. You
yeah,
know,
just
not a
one,
single
one moment, Dr. Grinspan, just before you continue. I'm just wanted to check, I see CPAC is recording this and we'll post it later. I'm just checking with CBC to see if there are any questions, or just checking the chat to let me see if there are any questions.
Is there anybody else who'd like to ask? If not, Mia, you can continue. Okay, I think we're good. Mia, go ahead.
Great.
I
Dr.
guess-
Grinspan, you had a comment.
Thank you. Yeah, I mean, look at who is in the vaccination task force, and that will answer to you everything. Every single year, and actually not just every single year, always, public health is in charge of vaccination, whether it's polio, whether it's children, whether it's flu, whether it's whatever. Not a single of those nurse experts of public health are in that vaccination task force. Not a single, like the entire way the government has conceptualized COVID, including vaccination, is an illness approach versus a precautionary principle approach. From the masks that were given first to hospitals rather than to nursing homes, to the vaccination now. And it's a fiasco of mega proportions.
Anything else, Mia? Or yeah? Go ahead.
I'm just curious if anyone has any further or explanation or discussion on the workers. I mean, we know that wages have been an issue, but have we seen evidence from provinces that any of their plans that they've brought forward or talked about since the spring will work, or is it too early? I mean, I know Ontario had an announcement not long ago. Quebec has done some things. I'm just curious how well those are actually working so far.
Well, I mean, I can start. I mean, I want to double down on the fact that I think BC, I mean, there was a lot of pushback at the beginning when Dr. Bonnie Henry and team actually said, look, we need to stabilize this workforce. And you heard originally, with the stories of what was happening in BC, where homes were firing staff, rehiring them at lower wages, putting them on part-time contracts and everything. It was just a recipe for disaster that's been played out over and over again across the country. And BC, the BC team went to the Minister of Health and said, we've got to pony up $10 million a month. It sounds like peanuts now, but they said that's what it's going to take to stabilize our workforce, right? By giving them the highest unionized rate, by giving them full-time employment, even if there isn't full-time work available. And that worked really well. And you can just see the numbers in the number of outbreaks that have happened in BC homes compared to Ontario or Quebec. And then in Quebec, by actually saying not this whole thing that, oh, it'll take years to hire up thousands of new workers. Quebec went right in May, and BC since announced that they're hiring 7,500 new workers. But by Quebec actually going out and saying we're going to hire 10,000 new workers, and by actually recognizing the barriers to say, we're going to pay for your time to go and train, we're going to pay for your coursework, we're going to guarantee you employment. Again, when you have Ontario with over 200 outbreaks currently in its long-term care homes, and Quebec with only 60, again, the data doesn't lie.
One of the pieces I just wanted to build on is by actually saying that none of this will matter unless we actually fix the insurance backstop problem, because right now long-term care is essentially uninsurable. And the insurance policies started coming up for renewal on January 1st. Almost all insurance in Canada for long-term care will be gone by end of March. So unless there's actually an insurance backstop by government, the doors to long-term cares will close, and they will start closing with the not-for-profit sector. So all of this is critically important. But if we want to keep long-term care even open, we have to fix this immediately.
Except
So
that
in Ontario, what they did for that is actually they passed a legislation to do exactly the opposite, Laura. The reality with staffing is that BC is more complex than only staffing. In BC also, they did the testing in the nursing homes right away. They did the PPE in the nursing homes right away. So they did a lot of other things, and they didn't focus only on hospitals. Here again, the approach is hospital, hospital, hospital. Let me be very clear, there is staff to work in long-term care. We have thousands of people ready to work in long-term care, and a government that still refuses to access that side to actually get the people. So give them, as you know, we are not the union, but as the union will say in our case, Linda Silas, give them good jobs, she will say, full-time jobs with good pay, and give them enough staff, because PSWs will escape if they don't have their RNs, their PNs, and nurse practitioners there. They simply will escape, and rightfully so, because they cannot handle the stress of the situation. So give them enough staff, 4 hours of care, 48 minutes of an RN, 60 minutes of an RPN, which is LPN in other jurisdictions, and 132 minutes of a PSW, and 1 nurse practitioner per 120 residents, and you will have a lot of people that will choose to work and will want to work in long-term care because they want to work. They love the sector. They hate the conditions.
That's right. I think that we're
Yeah, I think we got to go now. Thank you so much.
Yeah, I just want to again thank you all so very much. And again, I know that it can sometimes be tricky because I know I'm the leader of a political party, but at the same time, our approach to these things is always collaboration and cooperation, particularly when it's, as I said, a humanitarian crisis. So anything that you would like to share with us, please don't feel that it needs to be proprietary. You can share it with all of the parties. When we come to write our platform for the next election and our policies, we wanted to reflect what you have said and what you prescribe because you are the experts. And so I really hope that we will absolutely be reaching out to you. I hope that you will
give me one sec.
And so thank you very much. Paul, wait, sorry, no, you're unmuted. So you're muted, unmuted, sorry. Okay, and Paul, thank you so much. In our case, we're looking for universal long-term care, either modeled on or under the Canada Health Act. That's what we want. And in the short term, we are going to be echoing all the things that you've said today. Please reach out. I'm happy to give you all my personal number. This is very important to me. I promise we will not look away. And thank you so much for all that you've done today and continue to do.
Thank you, everyone.
Thank you, everyone.
Goodbye.
Bye.
Okay,
Annamie,
I'm calling you right now. Thanks, everybody.
Thank you.
everyone.
Thank you, everyone.
Bye-bye.
Bye.
Thank you.
Bye.